Imagine a robot not on a factory floor, but in an operating room, its delicate arms performing life-saving surgery. This isn't a scene from a futuristic movie. It's a reality happening in hospitals all around the world right now. Welcome to the incredible world of robotic surgery. You've probably heard of the Da Vinci system. It's one of the most famous surgical robots out there. Picture this: a surgeon sits at a console, looking into a high-definition 3D viewer, controlling robotic arms with incredible precision. These arms aren't clumsy metal claws. They're equipped with tiny instruments that can bend and rotate far more than a human wrist. This allows surgeons to make movements that are impossibly steady and precise on a microscopic level. It's like giving a surgeon superpowers, eliminating the natural tremor that even the steadiest human hand possesses. This technology is a game changer for delicate procedures, turning complex operations into more manageable tasks. The surgeon is always in control, but the robot acts as an extension of their hands, translating their movements into flawlessly executed actions inside the patient's body. So, how does this actually help? Well, think about long, complex surgeries that can last for many hours. Surgeons are human, and fatigue is a real factor. It can affect concentration and steadiness. A robot, on the other hand, never gets tired. It can maintain the same level of precision from the first minute to the last. This consistency is crucial in reducing the risk of human error. The robot acts as a highly advanced, tireless assistant, allowing the surgeon to focus entirely on the strategy and execution of the procedure without physical strain. This partnership between human expertise and robotic precision leads to safer, more effective surgeries. It's not about replacing the surgeon, but about augmenting their skills to achieve outcomes that were once thought impossible. The surgeon's brain and experience are still the driving force, but the robot provides the perfect hands to carry out their commands. The capabilities of these machines are truly mind-blowing. Some specialized robots are now able to perform tasks that are almost beyond human physical limits. For example, there are robots that can stitch together blood vessels that are thinner than a human hair. Imagine the level of detail and control required for that. This is particularly vital in reconstructive microsurgery, where reconnecting tiny vessels is key to success. In the realm of oncology, robots are used to remove cancerous tumors with astonishing accuracy. They can navigate through delicate tissues and remove the diseased area while causing minimal damage to the surrounding healthy organs and nerves. This precision is critical for a patient's long-term quality of life. By minimizing collateral damage, robotic surgery helps preserve function and leads to better overall outcomes. What's the secret sauce behind these incredible machines? A big part of it is artificial intelligence. The AI that guides these robots is constantly learning. It analyzes data from thousands upon thousands of surgeries performed by top surgeons all over the world. This massive database helps the robot understand the nuances of different procedures and even anticipate the surgeon's next move. The AI can provide real-time guidance, highlighting critical structures or suggesting the most efficient path for an instrument. It's like having a digital mentor built right into the system, one that has learned from the collective experience of the entire surgical community. This continuous learning process means the technology is always getting smarter, more refined, and safer, pushing the boundaries of what's possible in the operating room. For the patient, the benefits are life-changing. Traditional open surgery often involves large incisions, which can lead to significant pain, a higher risk of infection, and a long, difficult recovery period. Robotic surgery, being a form of minimally invasive surgery, changes all that. The procedures are performed through a few tiny incisions, sometimes just a few millimeters long. This means smaller scars, significantly less pain after the operation, and a lower chance of complications like infections. Because the trauma to the body is so much less, patients often recover much faster. They can get out of bed sooner, leave the hospital earlier, and return to their normal lives in a fraction of the time it would take with traditional surgery. It's a revolution in patient care, focusing not just on treating the disease, but also on making the recovery process as smooth and painless as possible. Of course, with any groundbreaking technology, there are valid questions and concerns. The biggest one is about trust. Can we and should we put our lives in the hands of a machine? What happens if the robot malfunctions? What if there's a power outage or a software glitch during a critical moment of an operation? These are serious ethical and practical questions that the medical community is actively addressing. Redundancies and backup systems are built in to prevent catastrophic failures. Surgeons undergo extensive training to handle any potential issues. But the fundamental question remains, how much control are we willing to cede to technology? It's a debate about the balance between human oversight and automated perfection. And it's a conversation we need to have as this technology becomes more widespread. Despite these questions, the momentum is undeniable. Hospitals across the globe are rapidly adopting robotic surgery. What was once a niche technology found only in a few elite institutions is quickly becoming the new standard of care for a wide range of procedures, from prostatectomies and hysterectomies to heart and lung surgeries. The benefits in terms of patient outcomes and surgical efficiency are just too significant to ignore. As the technology becomes more affordable and accessible, we can expect to see it in even more operating rooms. We are witnessing a fundamental shift in how surgery is performed. The operating room of the future is here, and it's being run by a team of human experts and their incredibly precise robotic partners. So the future is unfolding right before our eyes. The idea of a robot surgeon is no longer a fantasy. As this technology continues to evolve, powered by AI and data, the possibilities are almost limitless. It brings us to a fascinating question we all have to consider. If you needed surgery, would you trust a robot to do the job? Let me know what you think in the comments below. Thanks for watching, and if you're curious about where technology is taking us next, make sure to subscribe for more deep dives into the world of future tech.